welcome to the CDO Magazine interview series. I'm Todd Foley, CDO CISO with Lydonia. Today, I have the pleasure of talking with Chris Hutchins, SVP Chief Data and Analytics Officer at Lifepoint Health. Chris, good to see you again.
It's a pleasure to see you too, Todd. It's been an interesting few weeks, a lot of activity around CDO Magazine and a lot of great discussions. So I'm really excited to be here to chat with you today.
Fantastic, and we appreciate it. Chris, maybe we can start off with talking about how Lifepoint Health is leveraging AI, to manage, to streamline just the vast amounts of data generated across your network. I don't think you can talk about data without talking about AI these days, or talk about AI without talking about data.
100% right on that. Yeah, there's a number of ways that we are using it here at Lifepoint. And I think to first start is what I want to kind of speak on just for a moment, if I can, is the mission that we have. And this kind of goes into our thought process as we we start to think about where we want to leverage technologies and AI. We have our mission is making our communities healthier. And so that's the lens that we are looking through to determine which technologies are things that we should be looking at, which AI pilots, proof of concepts, or whatever that we choose to engage in. We're having some really interesting success with things around operational efficiency. And it kind of starts with some of the things that you would expect around governance. And we have that on our agenda to chat a little bit about today. But the interesting thing is it's one of the business partners we're working with. They're using AI to accelerate the normalization process in our logistics data. We've had an ongoing work effort for now a little over a year, and to try to get operational visibility in near real time to patient throughput in our organization. We're in 31 states, I believe, from an acute hospital standpoint, and all of our hospitals are in rural America. And so it's really, really important for us in the communities that we're in to take care of our patients. We have to have good visibility into availability of our beds and make sure that we're able to move patients through, because we have a significant amount of transfer requests. Again, we're in these parts of the country where there may be a couple of options, but there's a significant distance to travel to get to another one. And for the closest one, we have to do our best to make sure that we can say yes and accept that patient. So what we're doing there is really aiming at the operational throughput, giving the line of sight to our operators out in the field into when we expect a bed to be available. But it's got to be in real time, because they've got to have an understanding, okay, we don't have a bed now, but I can see in about 8 minutes, EVS is scheduled to be released. Right. So when they're taking the calls, they can actually answer, with some confidence. Up until we started to do that, it was really kind of challenging for them to give a solid answer, because typically our hospitals do have a high occupancy rate. But if you can't see the timing of those steps that are in between, it's really hard to make a good call. And you don't want to guess wrong and have somebody come and you don't have a spot for them. So anyway, back to the normalization concept. That's one of the things that we have to do, because there's so much variability. When you build a hospital, you implement your systems. No one's thinking, I could be part of a large health system one day.
Right.
And so I'm going to come up with a set of standards and tell all my friends, and we'll all do it the same, right? Yeah. So it's that challenge that replicates itself over and over again when you're bringing on board a new hospital into an organization. There's a set of standards that they've applied in their legacy systems. And now we have to kind of figure that out and come to a common language so that we can actually look at this as a system. And so the pace that these folks are moving to normalize it's mind-blowing. It's much, much faster than anything I've ever seen. And it makes sense, because they were just plowing through just gigabytes plus of data very, very rapidly
Yeah.
with there's software and technology, and they're able to normalize things at a pace that I couldn't do with a whole team of people even 2 years ago.
Yeah, and I think that's probably one of the things that's remarkable, right? Is that all of the traditional approaches using the latest and greatest in database technology, when it comes to challenges around integration and being able to map schemas and basically transform data, the ways that we do that historically have always started with people looking at the data and figuring it out. And that's
Yeah,
the long pole in the tent everywhere. But you have really unique challenges, right? With that kind of just large set of systems. A lot of them, you know, as you said, that grew up independently without a lot of thought to consolidation.
right.
You've got the data integration challenges that everyone has, just maybe 100 times as many, and the impact of that is even more magnified by just the fact that you are a lot of times the only healthcare provider or the primary healthcare provider in these rural communities. So something as
Right.
simple as, you know, bed inventory has a huge impact. I mean, if you have to travel hours to go from one location to another, that
Right.
availability has to be real time.
Yeah, it's a challenge that I think everyone has for the most part in healthcare at some point in their evolution. Really figuring out where does real time capability become an imperative,
Yeah,
and things like managing patient throughputs, accepting transfers, our ability to do that, having clear line of sight into our bed turnover and the timing and all the components that are involved with that, and of course, emergency services. Those are the areas that are really the most challenging, particularly in rural areas, because it's expensive to have real time data replication, and there's a high risk if you're connecting directly to the data sources, because these are the systems that people are operating in 24/7.
yeah.
So
Well,
it's definitely a challenge, but I think there's a lot of things coming that'll kind of facilitate this speeding up. How it's funded, I don't know, but our regulators always have good ideas on what we should do. Just so someone's going to figure out how we're going to pay for it.
well, I think, you know, you mentioned something when you were talking about the risk of connecting into operational systems, right? Where people are using those systems to make literally life and death decisions. But it's not just the risk of service interruption, right? Whenever we're
Right.
talking about healthcare data, there's tremendous risk of um, compromise from outside actors, constant concern around
Yeah.
security, even the partner you're working with around normalization. How do you overcome some of those challenges that are often a barrier to doing some of the things that you're doing and want to do?
But I think the short answer to that is that we're taking a very cautious and deliberate approach to it.
Yeah,
We're looking at the things where we can be reasonably confident that all of our safeguards are in place. So first and foremost, in everything that we evaluate, we have a strict set of guidelines that we test everything by with our CISO in our CTO and risk and compliance and legal. I mean, everyone's kind of plugged into these processes as
yeah,
we're evaluating what we're going to tackle. It's no surprise that given the climate that we're in and all the nefarious actors, as you mentioned, that activity seems to be just growing at an unfortunate pace, and the risks are getting higher. So we have to be super vigilant about making sure the safeguards are there. We try to make sure as often as we can that there's very limited opportunity for anyone to see the data outside of our firewalls. That there's some challenges there, but we work through the remote access obstacles that sometimes are there. We have to be creative at times to figure out, okay, how do we work this out in our agreements, all our legal documents that we have to have, make sure cyber is at the right level everywhere, make sure that there's, all of the, the policy centric things that we have to do just to function as a health system. But I don't know if there's 100% guarantee of that safety when it comes to accessing data. We're hearing certainly a lot more about it over, these days, particularly in the healthcare space. There's a lot of regulation discussions going on. Some I'm aware of, and probably many that I'm not. But we have to make sure that we have a line of sight, and whatever we're doing, we're cognizant of the need to be able to adapt and adjust to regulatory changes and requirements that may come.
Chris, thank you for joining me today. For those listening, please visit cdomagazine.tech for additional interviews. Have a great day and a great weekend.
Thank you. You too. It's been a pleasure, Todd.
Thanks, Chris.